Every single year, millions of dollars are dumped into infrastructure projects for the poor. And we all just assume the goal is super simple, right? Make people healthier, make people richer. But what if we're just completely wrong about what people actually want? What if our basic, everyday assumptions about poverty are entirely backwards? Welcome to This Explainer. Today we're unpacking a groundbreaking study that literally throws traditional development economics right out of the window. Seriously, get ready to have your common sense completely challenged.
So look at it like this. In the world of global policy, if you build this massive water project and people don't get physically healthier or they don't make more money, you failed. Boom, funding gets cut, the whole project gets slapped with a disaster label. But today, I'm going to show you exactly why that rigid mindset is entirely wrong. We're going to see how a project that actually failed on literally every traditional metric turned out to be a massive, life-changing success. Okay, let's set the scene in urban Morocco. $1,340. That's the upfront cost for a household in these neighborhoods just to get a private piped water connection installed. Now, for the urban poor, that isn't just expensive, that is an impossible wall. It's this massive, prohibitive lump sum. So instead of having a private tap, they end up spending hours every single week hauling these heavy containers from free public water taps. It is a grueling, exhausting, and just totally endless chore.
Section 1. A counterintuitive test. Testing human behavior.
Enter Nobel laureate Esther Duflo and her research team. They really wanted to test human behavior here. So they asked, what actually happens if we just strip away the administrative red tape and offer a little bit of credit? So they set up this VIP fast lane for a random group of households. Now, to be clear, no freebies here. Residents still had to pay full price, but they got a zero-interest loan. The researchers literally went to their homes, took digital photos of their IDs, and pre-approved all that agonizing municipal paperwork. They basically just erased all the friction.
And the result? Just a sheer explosion in demand. In the control group, the folks who still had to face the normal red tape, only 10% bought a connection. But our VIP fast lane group, oh man, adoption absolutely skyrocketed to 69%. Nearly 70% of people willingly signed up for years of debt just to get a private tap, simply because the bureaucratic hassle was finally gone. Section 2. Unexpected, face-slapping results that completely defy expectations. Okay, so standard economics tells us that clean water always means a massive leap in public health, right? Well, get ready for a major slap to the face. The researchers used these incredibly meticulous daily illness diaries. Mothers were tracking every single instance of diarrhea, vomiting, and fever for months on end. And the result? A massive, shocking zero. Honestly, there was absolutely zero drop in waterborne illnesses. The physical health of these families didn't improve even one single bit.
Okay, fine. So no health benefits. But surely, saving hours a week on fetching water has to mean more time to work or study, right? Nope. Here comes the second slap to the face. The data showed exactly zero increase in time spent working, zero increase in income, zero increase in school completion for the kids. Productivity literally did not budge. By every single traditional metric used by policymakers, this project was looking like a total, absolute failure.
And honestly, it gets even worse. Before getting this private tap, these households were spending roughly 78 Moroccan dirhams a month on water. But after getting connected, their bill practically doubled to 147 dirhams just to cover the new usage and that loan. Think about that. They took on massive debt. They're now paying twice as much every single month, and they aren't even a single percent healthier or richer. Which brings us to Section 3. What exactly did their money buy? Let's solve this mystery. So you gotta ask yourself, why on earth did 69% of people jump at an offer to pay double for zero health or income benefits? If it didn't cure their kids and it didn't boost their paychecks, what exactly were they buying? Well, the answer starts with this number right here, 0. That is the number of minutes they now had to spend fetching water. That grueling, back-breaking chore that used to eat up hours of their week, it instantly vanished. The entire physical burden was just completely eliminated. Section 4. The poor also need to chill. Buying mental peace. We often have this incredibly patronizing view of poverty. We just kind of assume that every spare minute a poor person gets must be spent hustling, just trying to survive. But the real motivation here? It had nothing to do with boosting GDP. They were buying mental peace. So
Where did all those saved hours actually go? Well, there was a massive increase in socializing and leisure time, basically just relaxing and watching TV. 0% went to extra work or study. They used the time exactly how you or I would. They just relaxed.
And the psychological benefits? Totally off the charts. Think about it. The daily grind of hauling water is a massive, massive source of stress. Who's going to fetch it today? Who used too much yesterday? By simply removing that one chore, family conflicts over water plummeted by 69%. And disputes with neighbors over water completely wiped out, just gone. And as a direct result, the self-reported quality of life among these families jumped by nearly 100%. They were paying double, yeah, but they were infinitely happier. The researchers actually summed it up perfectly. The sheer time and stress spent on water collection just crushes the welfare of poor households. What this explainer really proves is that mental peace, social cohesion, and just sheer happiness, those are vital, incredibly valid metrics for success. You don't always need to see a spike in income to prove a project actually works. Sometimes, just removing a massive daily headache is totally worth its weight in gold. Section 5. Great research and its limitations. Looking at the broader picture. Let's talk about the ripple effect first. Remember that control group? The folks who had to navigate all that awful red tape entirely alone? Originally, only 10% of them even bothered. But over the next 18 months, they sat there watching their neighbors in the fast lane group just chilling out, watching TV, and no longer fighting over water. I mean, pure FOMO set in. Adoption in the control group naturally jumped up to 27%. The perceived value of this newfound happiness was so undeniable that they eventually just pushed through the awful red tape themselves. Now, we do have to mention a really crucial limitation here. Why exactly were there zero health benefits in this study? Well, because the public free water taps in this specific part of urban Morocco were actually already providing perfectly clean, treated water. The baseline was already safe. If you took this exact same experiment and ran it in a region where the public water was highly contaminated, you absolutely would see a massive leap in health and survival. Context is quite literally everything in data. In this specific case, the entire benefit shifted strictly to leisure and convenience, simply because that baseline survival need was already being met. So we're going to end on this thought. This study is just a massive reality check for all of us. We so often design policies for robots, expecting every single dollar to yield some perfectly measurable health or wealth outcome. But humans aren't robots. If simply cutting some administrative red tape can buy a community this much profound happiness and peace of mind, what other supposedly useless investments are we completely ignoring? It's really time we start valuing the simple, basic human need to just have a slightly easier day. Definitely something to think about the next time you turn on your tap.